We also have with us Dr. Dodul Mondal, Associate Director, Oncology, Max Super Speciality, Saket. I welcome all of you on Sunset TV and thank you so much for joining us. Dr. Mondal, since we're talking about registry, now we understand that there is a national registry for cancer. We have population-based registry and also hospital-based registry. But the fact that in the population-based registry, only 10% of population is covered. We need something as far as rural India is concerned. So do you think that having a rural-based registry would be equally important?
Yeah, it's a very good question, and it's very important as well because as of now, cancer is not a notifiable disease like we are talking about COVID. So the registration or the information comes mostly on a voluntary basis. So as of now, if we see most of the registries what we have, they are either a population-based cancer registries, and of course the numbers are increasing. So right now we have almost 38 PBCRs, and then there are a lot of hospital-based cancer registries, and the number of hospital-based cancer registries are almost 250 or more. So what happens, we have seen in our real life experience that the same patient, they can come from one place and they can visit 10 other hospitals, essentially making a 10 times entry of the same patient, same disease, giving a false information of the actual incidence of the cancer. So like if we can combine a registry with a CoWIN-like portal system like you were discussing, probably that will reduce the risk of duplication or multiple entry of the same person. And we need to catch the entire data of actual occurrence of cancer, their stage, their demography, their treatment as per the plan, and whether they are actually receiving those treatment, and what is happening after the desired treatment, and how they are dying. So all this information should be captured in the registry system. And of course, a rural-based cancer registry is very vital because most of our population is as of now in they are residing in rural place of the country. So it's definitely important, and I believe there are a lot of works now going on like TMC, Mumbai, the Atomic Energy Regulatory Board, even the government from themselves, they are taking a lot of interest in expanding the registry program to capture more data.
Now we also have National Cancer Grid in place. Help us understand how is it helping in meeting this crisis?
National Cancer Grid, it's actually not a very new thing. If we know about the inception, it's almost a decade-old thing, and it was an initiative by the Atomic Energy Regulatory Board in collaboration with Tata Memorial Hospital, Mumbai, which is one of the epicenter, or you can say one of the apex center of cancer registry, cancer treatment, and a lot of research works. So the collaboration led a new concept that because of lack of uniformity in the criteria of diagnosis, then the staging, and then what treatment to offer on a community basis. Like we cannot offer expensive treatment to each and everyone, but then there has to be a basic minimum standard or a basic common standard which can be provided to everyone at an affordable cost. Also, there has to be a major scope or increased scope of collaborative research work between the country, among different institutes, and among the institutions outside country. So the purpose was to have a common platform to provide a uniform treatment recommendation and to increase the scope of research in the cancer field. That was the basic purpose of creating NCG. Now, if we see the current scope of work of NCG, it has actually much more expanded. Now we have second opinion platform also. So there is a virtual tumor board platform. There is option for having a second opinion. Say, for example, a patient residing at a distant place of the country cannot travel to a far-off place. They can easily send their documents with all the reports, and they can get a proper second opinion from that platform. Also, there is a on a regular basis, virtual tumor boards are happening. So that will definitely increase the quality of care across the country. So that was the basic purpose of creating NCG. Now there are other things also. A lot of research works are now happening through NCG by the collaboration networks. And as of now, there are almost 280 centers who are part of this National Cancer Grid. So they are sharing the information, they are planning for collaborative research work, because many times it happens that a particular cancer may not be happening very frequently at one place. But when you gather 50 centers across the country, you get a huge number of patients, and that can give more insight about the cancer and the management protocols. And of course, it's definitely beneficial for the patients and population to alert.
The committee also found out that there are differences in the different regions of India. For instance, the tobacco-based cancer is more prevalent in northeastern states. Do you think that we need a research which is based on the location, on the geographical conditions?
Yeah, so that's a very interesting finding, and we know that this use of tobacco in any form, be it chewable, smoking, and mixed with different other things like betel nut and then areca nut, so they're all known to be carcinogenic. That means long-term presence of them inside mouth, which is a very typical habit in northern India. They can cause a lot of chemical reactions, gradually leading to transformation of a normal cell into a cancerous cell. In contrast to that, the commonest pattern of using tobacco in northeastern states are more of a smoking form of tobacco.
Yes.
And the pattern of disease is a little bit different from cancer happening in northern India, who are where population are mostly using the chewable tobacco. Now, what we need much more is to increase the awareness. Like we all know that the pattern is prevalent in this part of the country, like most people are using tobacco, most people are smoking. So that information is already there. Now what we need probably enforcing the law to reduce the consumption, or to reduce the consumption of these things among adolescent age groups, youngsters. And then we need to increase the awareness by robust campaigning methods, maybe by spreading more of information literature, involving the social organizations, involving the schools where actually the education begins, and probably starting from a very tender age. If the information is given to them, the population will gradually switch to a better lifestyle, adopt a good lifestyle where they will smoke less, where they will use less of tobacco. So of course that's important. And just to add one information, or what I looks very interesting to me, is breast cancer and a couple of other cancers. Like if we talk about prostate cancer in men, they are mostly associated with increased life. Like the person is living a longer time, 70 years, 80 years. Many of times these cancers happen because of some hormonal changes, and as a person lives long, the risk of having those hormone-induced cancers are increasing, or more. Like it's very common in men to have higher risk of prostate cancer when their age is becoming 70 or 80 or more. And that's a more prevalent situation in Western countries, where people usually have a longer life than ours. Like they're living almost on an average a decade more than what is our average life. So probably that is also causing higher incidence of breast cancer, and we also see that there is a rise of prostate cancer in detection in men. So probably that's one of the reasons, and maybe we need to focus on that also.
Of cancer disease in our country, Dr. Mondal, one of the aspects again is very high cost, or the affordability aspect of treatment of cancer. Now we know that medicines, the equipment, they're extremely costly, or perhaps exorbitantly priced, if I may say. So then going ahead, of course, we have the Amrit scheme in place, but how do we ensure that the treatment of cancer is affordable for large sections of society?
So that's a very tricky question actually, because as of now, as I was telling, that cancer is not a notifiable disease. So once it becomes a notifiable disease, then you have to put certain things in place to make sure that anyone having that disease is actually getting the treatment as well. Now, the cost of cancer is definitely increasing with passing time, because the technology is advancing. The technology what we are using now is definitely not the same what we used to have 50 years back. So that used to be a cheaper technology. Now, technology definitely comes with a cost, and that also gives you benefit as well. It's not that the cost is increasing without any benefit. So the life, or you can say the survival, is increasing. The quality of life after treatment, which is very important in cancer survivors, that is also increasing. So a lot of time we hear from our patients that radiation causes this problem, chemotherapy causes this problem. Now, if we compare what people used to have 20 years back or 10 years back, the amount of life after treatment they had and the quality of life they used to have after those treatments, so there is a significant change, which is in a positive direction. So of course the cost of treatment is increasing, but it's also giving benefit to the patients. Now, maybe in some situations, like I was telling you, that the purpose of this inception of NCG was to create an uniform standard of care which will be affordable. So maybe by more collaboration among the centers with active involvement of the teaching institutions and research institutions to see the amount of difference between a cheap treatment or affording treatment versus a costly treatment. And if the difference is not very significant, then one might resort to a less costly treatment compared to a very costly treatment after properly explaining the patient, where affordability is an issue. Of course, if someone can afford, then sky is the limit. Like often we give an example that you want to ride a car, you can, but if you want to go 100 feet or 100 meters, you can also walk easily.
Exactly.
But that comes with cost and affordability. But of course, it's a need of the time that we devise some treatment protocol which should be or which can be used across the country without significantly reducing the outcome of the treatment. That definitely we have to prioritize.
All right. Another issue stemming from the affordability part of it, Dr. Mondal, is about the insurance. Now,
Yes.
cancer is generally not covered under insurance. Going ahead, do you think that we can have some innovation in that sense also, that we do have cancer as far as insurance is concerned?
Let me just start from where Dr. Seenu started his opinion. Like majority of these patients nowadays, they are heading to a private hospital because of course lack of proper timely treatment facility in overwhelmed government institutions. Just a small information, like the new 22 AIIMS which has been created, only 6 out of those 22 are actually having a full-fledged oncology facility. So of course patients need a treatment which should be time bound, because time is the key in success of cancer treatment. So patients are essentially resorting to private hospitals, and I myself, I work in a private hospital, so I know how things happen. So most of them are actually insured. It's not that the insurance companies are not covering on cancer patients. There is a minimum time interval from the day of inception of the insurance and starting the claim process. So say for example, someone coming to me who has started an insurance process yesterday and detected a cancer today, he might be denied based on the terms and conditions of the insurance companies. But majority of the insurance companies are nowadays actually covering cancer treatment. They may not be agreeing to comply with the very costly treatments like immunotherapy or very expensive radiation treatments, but the basic affording treatment what we were talking about, almost all insurance companies, be it a GIPSA or non-GIPSA, they are actually covered. So to be very pragmatic, what nowadays I start telling my relatives or friends that start having an insurance at early age of life where the premium will be less. Right. As your age increases, the same coverage will come probably at a 5 times or 10 times costly insurance package. So that's very important. And also there are a lot of public sector units, PSU, government run facilities like CGHS, ECHS, yes. You might be aware of these things. So government also takes care of a huge number of population by providing extremely good facilities to have the cancer care and cancer treatment. So common people need to understand their need, should have an insurance, and I believe it's a need of the time because treatments are becoming costly. Right. And at a proper age when the insurance, probably the cost will be less. So 2 big takeaways, of course, have insurance early in life and adopt healthy lifestyle. On that note, thank you so much for joining us, gentlemen. Thank you so much. Well, viewers, that's all I had for you in this edition. Thanks for watching and stay tuned to Sunset TV. Namaskar.